Dear friends, I am Dr. Praful Chandra Patel. Welcome to YouTube Dr. Vet channel. Today's lecture is on simple indigestion in domestic animals. There are many types of indigestions in the ruminants: simple indigestion, alkaline indigestion, acid indigestion, vagal indigestion, and other type. In this simple indigestion, how it is simple, that we'll see in this lecture. In this slide, we study details about simple indigestion, definition, etiology, pathogenesis, clinical findings, diagnosis, difference diagnosis, and treatment aspect of simple indigestion. Let us understand what is simple indigestion. It is a mild form of rumen dysfunction, occurs most commonly in cattle and rarely in sheep and goats, mainly caused by dietary factors due to abrupt change in both quality or quantity of the food or diet. There are several manifestations characterized by impairment of rumen function for 24 to 48 hours, inappetence to anorexia, subclinical or complete atony of the rumen, infrequent defecation to constipation. Let us understand the simple indigestion in a more simple way and how it is simple. There are many rumen dysfunctions: acid indigestion, alkaline indigestion, vagal indigestion. But here the indigestion is very simple. It is very mild and commonly occur in cattle and sometimes in sheep and goats. The main etiological factors are dietary factors. The food is the cause. When there is all of a sudden change in the diet, both in quality of the diet or quantity of the diet, it manifests a simple indigestion. Manifest by impairment of rumen function. The main findings, clinical findings of the simple indigestion. And it is only for 24 to 48 hours. That's why it is simple. The duration of indigestion or disease is very short, 1 or 2 days. An animal manifests partial anorexia, inappetence, or complete refusal of the food, anorexia. Sometimes there is a mild atony of the rumen, and sometimes there is complete loss of motility of the rumen. Defecation is reduced, and it may reach up to the constipation. And disease is very simple. Many a time without treatment, there is correction of the case, and the disease is only for 1 or 2 days. Main etiological factors are the dietary factors. That's why it is a simple indigestion. Etiology of the simple indigestion. Any dietary factor that causes Change in the intraruminal environment leads to simple indigestion. There are two types of intraruminal environment, and the changes are changes in the motility and changes in the microflora. These are the two. The main etiology we have seen, dietary factor. Abrupt change in quality and quantity of food, the main etiological factor, and that happens because of the sudden ingestion of highly palatable food. When highly palatable feed is there, the animal consumes more, quantity is affected. Corn or silage, they are more palatable. Animal consumes more. Ingestible roughage, especially during drought period, the animals are compelled to eat these things because of hungry. During drought period, the water is also not also available. When animals are fed with excessive concentrate containing carbohydrate nutrition, that also lead to indigestion. Excessive protein material, many a time post-parturient cows eats its own placenta, and placenta is highly proteinous substance. So that also lead to indigestion. Various non-proteinous nitrogen substances, especially addition of urea and ration, that also lead to the indigestion. We have seen the main etiological factor, the dietary factor, sudden change in quality and quantity of the food. But sometimes animal factors also play a role. The old animals, debilitated animals, exhausted animals, especially during late pregnancy, lack of water, and presence of other concurrent diseases also causes simple indigestion. From a clinical point of view, drugs, especially prolonged use of antibiotics or sulfonamide orally, that inactivates the rumen microorganisms, lead to indigestions. Ingestion of various other materials, plastic bags, nowadays use of plastic almost in every way. So animal accidentally consume plastic bags, clothes, sand, kitchen garbage, moldy or decomposed food, sewage water. These things also lead to simple indigestion. Pathogenesis of the simple indigestion. Any change in diet cause change in rumen content pH. Normal pH is ranging from 6 to 7.5. The rumen pH become either acidic or alkaline. When there is change in the pH of the rumen, leads to decrease in ruminal motility. Main pathogenesis. Ruminal environment changes, ruminal motility. Ruminal motility decrease both in frequency and amplitude. and that manifests a disease, indigestion. And the second pathology is change in normal flora. So there is change in ruminant environment. One, it leads to decreased ruminal motility, important thing. Then another is the change in normal flora. And these two conditions leads to indigestion. If there is heavy carbohydrate nutrition fed to the animal, that produce lactic acid in the rumen and which lowers the pH of the ruminal content less than 6, the rumen content become acidic. The excessive proteinous food and non-proteinous nitrogenous substance produce ammonia nitrogen in the rumen and it produce a alkaline medium in the rumen content which increases the pH more than 75. That leads to alkaline indigestion. There is excessive histamine release and that leads to ruminal atony or decreased motility of the rumen. Important point to remember for the clinician is prolonged use of antibiotic orally. They suppresses rumen microorganism activity and they kill the rumen microorganism also. Leads to indigestion. Accumulation of excessive quantities of indigestible feed and that may physically impair the rumen function. That also lead to the indigestion. Clinical findings. The clinical signs depends on the type of animal affected and cause of the rumen disorder. The important symptoms are inappetence, means partial anorexia or complete loss of hunger, anorexia. The rumination is suspended. There is subclinical to complete atony of the rumen. Feces become duffy or little bit hard. Less frequent defecation. It may lead to diarrhea also. There is dullness and depression, moderate drop in the milk production. Clinicians generally palpate the rumen through the left paral number fossa, left flank. The rumen is usually full because there is ruminal atony. Onward passage of the ruminal content is stopped. The mass is either firm or duffy, means bit soft. The primary contraction of the rumen are decreased in rate or absent, but the secondary contractions are usually decreased in the strength. So both here the number of contraction is also reduced. At the same time, the strength of contraction of the rumen wall is also reduced. There is a spontaneous recovery in most of the cases, even sometime without treatment or by simple treatment with ruminatory drugs within 24 to 48 hours. That's why it is considered as a simple indigestion. Simple indigestion, if due to excessive feeding of the grain, it is manifested by little bit more severe symptom: anorexia, ruminal hypomotility to complete atony, rumen contain excessive fluid, the feces become soft and many a time a foul smelling. The diagnosis of simple digestion, as it is simple, it is easy also. There is history from the attendant or owner that there is abrupt change in the nature or amount of the diet. So based on history, diagnosis is also easy. Clinical findings are also characteristics. Rumen functions are also changed, become dysfunction due to certain other disease also. Acid indigestion, alkaline indigestion, impaction, vagal indigestion. So exclusion of the other causes of the dysfunction of the rumen, we will see that thing in the differential diagnosis. There is also help in the diagnosis of the simple indigestion. It is simple. More confirmation about the disease is collection and examination of ruminal fluid. The pH become abnormal, either decrease less than 6 acid indigestion or more than 7 to 7.5, the media become alkaline indigestion. Normal range is 6 to 7.5. There is great decrease in the number and size of protozoa. There is a prolonged methylene blue reaction time. This methylene blue reduction time is a measure of bacterial metabolic activity. Anorexia, atony of the rumen is also observed in many other diseases also. So here we'll see here how simple indigestion can be differentiated with other similar diseases. One disease is traumatic reticuloperitonitis. Here there is severe systemic reaction, and if the deep palpation is applied on the xiphoid area, the animal shows a pain reaction. Similarly, other disease, ketosis. For the ketosis, there is history of starvation at the peak production period and presence of ketonuria, presence of ketone body in the urea. Vagal indigestion, it has a very long course. Displacement of the abomasum, characteristically, tinkling sound is heard on auscultation on the abomasal area, especially a right floor of the abdomen. Abomasal torsion, the disease has a longer course. Grain overload means excessive intake of carbohydrate rich food. The disease manifests as severe symptoms, and there is characteristic fall in the pH of the rumen, that is even sometimes less than 5 pH. This is how we can differentiate these six diseases from similar symptoms. Treatment of simple indigestion. We have seen that the main cause is the dietary factors, change in quality and quantity of food. So here simple treatment, correction of the suspected dietary factors. Correct it immediately, this will become alright. Many a times spontaneous recovery is observed when animals are fed with a typical normal ruminant diet, because dietary is a factor. So we are removing the factor, spontaneous recovery. Sometimes it requires treatment. You know that there is atony of rumen. So important treatment is restoring of the rumen contraction. Clinician can give rumenotonic drugs and administration of about 20 liters of warm or saline solution via stomach tube, followed by vigorous kneading of the rumen. Fist movement is applied on the rumen that initiate the rumen contraction. Another important treatment is ruminal cud transplantation. Collection of a fresh ruminal fluid or a content from a healthy cattle, either from a slaughterhouse or even ruminal content of the goat. And if that ruminal content is given to the simple indigestion case suffering cows, about 4 to 8 liter ruminal fluid orally. So here in the treatment we are taking care of the rumen contractions. We want to restore the rumen contraction. At the same time, we want to normalize the rumen microflora. So these two treatments are very important. Correction of the rumen pH. If the rumen environment is corrected to normal, the rumen microflora become viable. On history, we come to know that animal has consumed excessive amount of carbohydrate. It leads to acid indigestion. So give alkali treatment, magnesium hydroxide orally. If we come to know that animal consumed more proteinous food or urea, there is alkaline indigestion. Use acid, the common acid available in the market or in the kitchen is vinegar, acetic acid orally. Vitamin B1, B6, B12, they are the nervine tonics that help to restore the motility of the rumen. If there is impaction by the fibrous food, correction of impaction by a 4 or 5 liter of mineral oil orally. Symptomatic treatment, if there is constipation, give saline purgative or parasympathomimetic drugs. Prophylactic treatment: massage the rumen from downward to upward, either by flat hand or with the help of fist with some pressure in the left paralumbar fossa or in the left flank. That will also help to induce motility of the rumen. Withhold of the food for 24 hours, the best treatment. Indigestion, the food will be digested. Simple digestion can be corrected very easily. Some cases, especially dehydrated cases, require electrolyte solutions, both oral or intravenous, that can correct electrolyte and acid base abnormalities, whatever the case may be. If acid indigestion, alkaline indigestion, that can be corrected by this electrolyte solutions. Dear friends, thank you very much for observing Dr. Weight video. In future, I will come with more important videos. Remember Dr. Weight logo. Requested to subscribe the channel. Requested to share this video to veterinary friends. If you like this channel, please press the like button, and also your views are also suggested, requested to give the views also. Thank you very much.